Hello everyone, how are you? Welcome to another videos for MRCS exam and solve of the question. That means question solve is one of the best way to prepare yourself for MRCS exam and carry out a better marks and pass the MRCS exam easily. So here the question. First of all, read the question very carefully. A 25 years old man sustains a severe midline, the middle cranial fossa of the base of the skull fracture. Once he recovers, it is noticed that he has impaired tear secretion. This is most likely to be a result of damage to which of the followings. So after careful reading, we have to find out the key points of the question for answering the question. So here a 25 years old man sustained severe middle cranial fossa basal skull fracture. Once he has recovered, it is noticed that he has impaired tear secretion. So what is the result of the damage? So which of the organ or which part is damaged, and for this tear secretion is impaired. For this we have to first of all we have to see the tear pathway or mechanism of tear. So here the options are stellate ganglion, ciliary ganglion, otic ganglion, trigeminal nerve, and greater petrosal nerve. So we have to find out one of the options which is the structure which may be damaged during the procedure and impaired tear secretion. So here in this picture we can see here this is the nose, and above the nose there is the eye, and here we can see the brain, medulla oblongata, pons here, and other structure here. So here we can see from the brain, from the superior salivatory nucleus, the fibers arises and it comes down, and at this point this is the geniculate ganglia, and from the geniculate ganglia a fibers comes there, and this nerve is the greater petrosal nerve, and they reach at the ganglion, that is pterygopalatine ganglion, and from the pterygopalatine fiber of ganglia a fiber goes to the eye. So this pathway, any disturbance in this pathway or any damage in this pathway, you may impair the tear secretion. So first of all, superior salivatory nucleus, any damage to the superior salivatory nucleus may impair the tear secretion. The second one is the geniculate ganglia. So any lesion or any damage to the geniculate ganglia may impair the tear secretion. Then here we can see the greater petrosal nerve. The greater petrosal nerve, the fiber goes. So any damage to the greater petrosal nerve, here it may also impair the tear secretion. And finally, it is the pterygopalatine ganglion. So this ganglion here, any lesion or any tumor or any structure which may damage, or any trauma if damage here, then tear secretion also be damaged. So this we have to find out in the options these 4 points, such as the pterygopalatine ganglion, greater petrosal nerve, geniculate ganglia, and superior salivatory nucleus. But most of the time in the question there will be present in these two terms. That means one is greater petrosal nerve and another one is pterygopalatine ganglia. So we have to find the greater petrosal nerve and pterygopalatine ganglia first. And in the question, almost all of the time the one of the two options, that is greater petrosal nerve and pterygopalatine ganglion, they are present in the options. So here we can see here this is the greater petrosal nerve. So this greater petrosal nerve that present at this point, it may be damaged during the trauma. So the greater petrosal nerve, it may be impaired during the middle cranial fossa skull base fracture from any trauma, and it may be impaired tear secretion due to damage of this greater petrosal nerve. So our final answer is the greater petrosal nerve, but if there pterygopalatine ganglia present, then it would be the pterygopalatine ganglia. So here the options greater petrosal nerve. Thank you all.